Hello, 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 and welcome. My name is Arianna Wenlant. I am the physical therapist and owner behind ANW Physical Therapy. I do have my doctorate degree, so you can call me Dr. Arianna or Dr. Ari. But ultimately, I am here today for the first episode of what will ideally evolve into a really educational and fun podcast, kind of like a longer content discussion about the work that I do, how I show up in my community as a physical therapist, and the techniques and interventions that I use to treat the people around me, to treat my patients, and so on and so forth. So this is really, really exciting for me. It's been a passion of mine for a long time, or kind of like that dream for me for a long time to start something like this, just because I have always been so passionate about educating and education as a whole, specifically because it is unreal the amount of empowerment that you receive or that you feel when you are properly educated. And so this is going to be my effort at communicating and educating others about, again, what I do as a physical therapist, but even touching into the holistic health space. I know that there's many sources of information when it comes to holistic health and functional health and all those kind of categories that get grouped into there. And I have a bit of a unique experience because of my specialization. And so, again, this podcast is an effort to create a place to talk about the holistic medicine world and holistic medicine kind of topics of interest from the perspective of a more holistic physical therapist, which is essentially what I kind of categorize myself in, because I evaluate the whole body and the whole system. And we'll kind of dive into that in a little bit here, but again, I think that the techniques that I specialize in give me an interesting kind of worldview or an interesting perspective on a lot of the things that people are talking about nowadays, whether on other podcasts or social media or even just within different communities. So that is what this podcast is all about. So truly today is just more of an introduction. I hope you get to know me a little bit more. I'll talk about my story, and then I'll talk about my business a little bit, kind of what led me to starting my own business. And from there, I'm going to chat a little bit about what my specialization is, which they're manual therapy techniques called visceral manipulation and neuromeningeal manipulation. So a lot of big words there, but I'll be talking briefly about what those are and ultimately kind of start to globally go over how I use those with my patients. So I'm super glad that you're here. I know that this podcast is likely going to evolve over time. As you can tell, I mean, right now I'm calling it ANW Physical Therapy, or the ANW Physical Therapy Podcast. That's essentially the name of my practice with the word podcast attached to the back end of it. So not super creative. I will be brainstorming an actual name for this podcast in the near future, but nothing has kind of come to me yet. So we'll see where that goes. I also want to say that ultimately, my goal moving forward with this, again, just thinking about that perspective on education and really being passionate about others being, empowered by what they can learn and what they can know about their bodies and how to address certain issues in their bodies. I will be having guests on this podcast over, the life of it, essentially, ranging from patients that agree to kind of come on here and want to talk about their experience with the work that I do. And then I'll also be having Christian Wenlant, my husband, come on here occasionally as well, because through obviously knowing me and being associated with the work that I do based off of me treating him as his partner, he is very passionate about it. And I think that he adds an interesting perspective in terms of kind of being able to represent more of the lay person. And he'll be here every once in a while being, asking questions and making sure that I'm not staying too high up in the, medical jargon world and bringing it all back down to a level that is very easy to digest and comprehend. So With that being said, again, my name is Arianna or Dr. Arianna. A lot of people call me Ari, Dr. Ari. I've kind of heard all the different variations. Like I said, I have my doctorate in physical therapy. I received my doctorate from Regis University, which is here in Denver, Colorado, which is where I currently practice from. I'm originally from Southern California, grew up surfing basically at the beach every weekend. I played competitive soccer, competitive tennis, and then dabbled in a few kind of sports on the side, which ultimately those experiences are what led me down the path of becoming a physical therapist. So I had a really incredible mentor when I was in high school who was a physical therapist, and she let me come and shadow her and see what she does. And that's ultimately where I started to really fall in love with it. So that led to me pursuing a major in kinesiology. I went to Texas Christian University. That's where I got that degree, my BS in kinesiology. And then again from there to Denver, Colorado, where I went to Regis University. And truthfully, the why behind it all, there's so many different tidbits that I can really focus on, but ultimately I love working with people. There is nothing that brings me more joy than being able to sit alongside someone and help them understand what might be going on with their body or within their body, give them the power to kind of make better decisions about how to, what steps to take in order to feel better and to function better, but then also to walk with them through what can ultimately sometimes be a really challenging journey through the healing process. And that's ultimately what I'm passionate about, is being able to walk alongside people through difficult times in their lives and ideally facilitating healing and restoration and function and longevity in that whole process. So with all of that, I'm also a massive anatomy nerd, a massive physiology nerd. I'm just so passionate about understanding more about the body, how the body works, and then again, just applying that over and over again within my practice and my studies and a lot of my continued education. So with that kind of little segue to how I've trained in the specialization that I have, and that has ultimately been all postgraduate. So received my doctorate from Regis, and everything that I have pursued from then on has been really my own kind of a new, I guess, how do I even really talk about this? So it's really kind of a more recent in the relative grand scheme of my education process, passion, something that's been really heavy on my heart, not only as a patient myself, but also just seeing and really observing how the healthcare system works and seeing people that just fall in the cracks, ultimately prolonged experiences and being really just witnessing that time and time again, over and over again. I just got sick of it and decided that something needed to change. There's more that can be done. Something is missing, and that led me to my specialization in, again, visceral manipulation and neuromeningeal manipulation. And truthfully, I love my orthopedic background, my orthopedic work, and how I've learned and can utilize that from physical therapy school. But my practice of the visceral manipulation and neuromeningeal work is what is just, it is unbelievably profound to me. It is something that not only I have received really significant healing from personally, but also I'm just amazed to see how it works in the life of, the people that I work with, the people that I treat, the people that my colleagues treat within the work. It's really, really, really profound. So I'm excited to talk about that a little bit more. But before I do, I want to draw a little bit of attention to my practice. So ANW Physical Therapy is the name of my practice. I am a cash pay practice, again, out of Denver, Colorado, specifically in Littleton. And I am so passionate about, again, what I talked about earlier, sitting with people and being able to walk alongside of them through challenging points in their life. And really what I think enables me to do that well is 1 hour or 60 minutes of one-on-one time with each of my patients every time that they come and see me, and really doing a holistic, a whole body evaluation to identify all the different factors that can be playing a role in symptom presentations or what that patient is going through. So I do practice in the orthopedic space. I do love, again, like I said, using my orthopedic skills, but I also incorporate the visceral and the neuromeningeal work. And so the people that I see in my practice it's really, really wide spectrum with a lot of variability and variety, which is so freaking awesome as a physical therapist, especially coming from, a job where I used to work in a very large corporate, high volume physical therapy practice. I can't even begin to list how different I treat now, or how differently structured my practice is now compared to what I used to do. I've lost my train of thought, but ultimately I love the orthopedic work, and then I use my specialization. So yes, my clientele is very variable. So I see people from young athletes with chronic heel pain to, mid-20s, 30s, chronic shoulder pain to, postpartum to, elderly individuals with, chronic constipation. I mean, there's so much fluctuation between all that. And it could be, a child with chronic constipation. But ultimately, I work with a lot of GI dysfunction. I think that's really, really common. It's also very, very common that people are, seeking out support and help and treatment for chronic GI dysfunction. So a lot of individuals, again, with constipation, with SIBO, with, chronic bloating, maybe they have gastric reflux or heartburn, maybe they have hernias. That really makes up a large portion of the population that I treat. And then I will also see individuals with, post-trauma, so post-significant physical trauma with concussions or various injuries resulting from that trauma, and even some emotional trauma. And this is, a topic, it's a rabbit hole that we can get into in the future, but there is a really, really significant link between emotional trauma and emotional distress being harbored in the body and creating physiological disruptions. And so this work is really, really great at creating a bridge between the two things and making sure to work through that. So yeah, that's kind of like very, very general what I do, what I see. I want to throw in also that I see a lot of individuals with pelvic pain of any kind, really, whether it's post C-section or postpartum to, just nagging hip pain that hasn't gone away for forever, and how that's kind of tied to the pelvic floor, maybe some pelvic organs, so on and so forth. So again, clientele is very, very broad. But the work is incredible. The visceral work is incredible at really treating and creating really beautiful opportunities for healing with those individuals that struggle with those types of symptoms. So super, super cool. That's my practice. What did I say was next? I think talking about the work that I do. So why don't we go ahead and chat about visceral manipulation? So visceral manipulation is like the key, kind of like the hub of what my specialization is. So visceral manipulation, and I train through the Barral Institute. Its founder is Jean-Pierre Barral. He is a French osteopath who founded this work based off of a lot of his own experience and study, actually at a pulmonary hospital in France. And if I'm getting my numbers right, I believe he started bringing this work and kind of teaching it in the United States only about 60 years ago, with which in the grand scheme of medicine is relatively new, because medicine moves super, super slow, especially in the U.S., in terms of kind of developments or changes and things like that. So visceral manipulation is really at like the heart of what Jean-Pierre Barral teaches and preaches, and then kind of spiderwebbing from that are, the neuromeningeal manipulation techniques, and there's vascular techniques, and there's articular techniques, and kind of so on and so forth. So it's kind of like a very big map of, different ways that you can really go. So visceral manipulation, it's a very gentle manual therapy technique. So at its foundation, it's a manual therapy technique, a hands-on technique that very basically works to improve the mobility of organ systems so that they can support the body better. It follows the principle that everything needs to be able to move in order to function. Everything has to move in order to function. Movement is life, right? And if something doesn't move well, it's not going to function well, okay? So visceral manipulation evaluates deeper structures. So we're going beyond the musculoskeletal system, or let's say deeper to the musculoskeletal system, in looking at organ systems, right? Fascial networks, blood vessels, nervous tissue, deeper pieces of anatomy that may not be moving well. And if they're not moving well, then they're adding to the dysfunction that you might be experiencing. Okay. So that's visceral manipulation, again, on a very broad kind of foundation. An easy example that I can kind of talk to that starts to maybe help individuals piece together why this is important is ultimately with breathing. So good diaphragmatic breathing, the diaphragm, which really is going to divide the body or the torso in half, right? You have above it your thoracic cavity, and then below it your abdominal cavity. So in the abdominal cavity of all your digestive organs, you have your stomach and your small intestine and the colon and the kidneys and so on and so forth. And then above the diaphragm, you're going to have, your heart and your lungs, the esophagus, trachea, that type of stuff. So ultimately when you breathe, the diaphragm drops, right? It descends as you inhale. And so everything that's below the diaphragm, okay, if you're imagining even just loosely a bunch of organs sitting below your diaphragm, every time you inhale, the diaphragm has to drop in order for you to, your lungs to fill with air, and everything that's below it has to be able to move with it. Otherwise, the diaphragm is going to get stuck and it's going to compromise your breathing, okay, or your ability to take in a full inhale, okay? And then as you exhale, the diaphragm comes back up. And same thing, everything below it and above it, right, has to be able to move with it. And so you can start to kind of imagine this like rhythm that's happening 24/7 every day as you're breathing over and over and over again of this movement that has to happen internally. And it's really profound to actually see how much movement happens. You can actually look up like imaging, like MRI imaging. I think it's MRI or MRI imaging of it's like a live image of someone breathing, and you can see the diaphragm and all the organs moving and stuff. It's really, really wild. But again, if something below or even above the diaphragm is not moving well, the diaphragm won't move well. And what I see the most often that kind of impacts or kind of plays a role in that scenario is with the liver. So the liver sits over on the right side of the body primarily. It's right up underneath the diaphragm. Okay. And it's heavy. I mean, it's a big, dense organ. And for many reasons, the liver can lose mobility from whether it's experiencing previous inflammation or infections or because of a trauma, like an impact to the side. Nutrition has an influence on that, so on and so forth. But if the liver doesn't move well, it compromises significantly the mobility of the diaphragm. And so that just creates a chain of reactions that starts to impact your physiology and how you feel and how your body moves as a whole, especially because the liver also sits up along the thoracic spine. So if the liver's not moving well, the thoracic spine's not going to move well. And if the thoracic spine's not moving well and the diaphragm's not moving well, now you're starting to get an alteration in rib cage mechanics, which then impacts the scapulothoracic joint, which then impacts the shoulder, and so on and so forth. You can kind of see really what, like the bigger picture of what happens here. Ultimately, you have to understand that everything is connected and is related in some way. And I know that our understanding of that continues to progress, which is such a beautiful thing, but it's still not common knowledge. Or we might say, oh yeah, everything's related, but we don't understand or really give that gravity or the importance to that statement. But it is absolutely so true. Everything is related and connected in some way. And so you have to evaluate all the pieces that could be playing a role in what's going on. Okay. So again, that's the beauty of the visceral manipulation work. We are trained in very specific evaluation techniques that start to analyze those deeper structures and then, look at the mobility of things that might not be moving well, and then treating that in order to improve mobility and improve function of that structure. So really, really incredible, super powerful. And there's so much beautiful healing potential with the work. Another little branch from that, right, is the neuromeningeal manipulation work, and ultimately follows the same principles but more specific to neural tissue. So looking at the central nervous system and the peripheral nervous system. Central nervous system is the brain and the spinal cord. Peripheral is basically all the nerves that then come into the rest of the body. Same thing. Our nerves, especially the peripheral nerves, if you can imagine, let's say even in your upper extremity, from your shoulder to your elbow to your wrist, anytime you completely extend your arm out and you rotate it and you rotate the hand, you kind of flip it up and down and you make big circles, nerves have to be able to glide and slide within the body so that they continue to function well and they don't give you pain or neuropathy or changes in muscle strength. So on and so forth, okay? So the neuromeningeal work is very specific to the nerves of the body, and working to reduce any potential areas of compression or irritation so that the nerves can continue to glide and slide well and not give you crazy symptoms, okay? So those two areas of work, they really beautifully coincide together. Because ultimately everything within the body has to be able to glide and slide in relationship to one another. And again, as you can imagine, if one thing doesn't move well, it's going to impact the thing next to it and just kind of set off a chain of reactions. So really, really incredible work. I personally have seen so much healing from this, which I can talk a little bit about, but I've, struggled with chronic low back pain up until about 4 years ago. Let's see, I'm trying to think when I started experiencing the work personally. About 4 years ago had been 8 years of chronic low back pain. Sorry for the confusing timeline. But I had basically chronic low back pain through high school, college, and all through grad school, essentially. So end of high school, all through college, and then also through PT school. And, as a physical therapist, obviously in PT school, you're like, I got this, right? Like, I know how to treat low back pain. That's like my specialty. We got this, and ultimately through doing all of the things that I was learning at the time and seeking out, help from clinical instructors or other kids in my class or other physical therapists or instructors at the university, I would get, a little bit of relief here or a little bit of relief there, but nothing fully resolved it. And it was super, super challenging because ultimately my low back pain only manifested at night. Okay. So whenever I went to bed and I laid down specifically on my left side, it was not a good time, not a good time at all, because I would ultimately wake up with searing red hot pain all through the left lower quarter of my lumbar spine or like the low back, all the way over to my left hip, and then sometimes into the glute or the back of my hip. And it was brutal, because ultimately it starts to compromise how you're sleeping, your sleep quality. And then I could only lay on my right side, and then my right shoulder starts to bug me because I only, I'm putting so much pressure on that during the nighttime. So ultimately not a good situation. Plus, in PT school, there's a portion of the class a portion of our studies that's identifying red flags, right? Because again, we're healthcare providers. If someone's coming to us and they start listing a number of symptoms that, is indicating there's a medical emergency going on, we need to be able to identify that and then refer them to the right person or the right place. And so a big part of the red flags that we learn is that pain at night, pain that primarily worsens at night and is persistent, is technically a red flag for cancer. So with that being said, before anybody starts to freak out who might be experiencing pain at night, this is not always the case. But it's just one of those factors that we learn, right? So that's kind of sitting in the back of my mind, is like, oh my gosh, I'm in my 20s. what is happening to me? Do I have cancer? I thought I was healthy, blah, 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 blah. So not a really great mental space to be in. Ultimately, I ended up in a functional medicine practice after seeing everybody that I could imagine, from PTs to chiros to massage therapists, kind of so on and so forth in there. Ended up in a functional medicine office from the recommendation of a friend. And the owner of the practice is a chiropractor. So I'm like, okay, this is great. So he's going to be another chiro to give me an opinion on the orthopedics, the orthopedic kind of, or the biomechanics of my spine, and so on and so forth. And then you might have a little bit of an interesting different perspective. We'll kind of see what goes on. And ultimately we end up ordering an MRI, which I hadn't had any imaging done at that time. And there's nothing on the MRI, right? So we kind of crossed cancer off the list, thank goodness. But I'm still experiencing my symptoms, and it's brutal. Ultimately, this provider took a step back and said, Arianna, I know this sounds super out there, but let's give something completely different a try and let's see what happens. And ultimately that started with big nutritional changes in my life. So I actually did an elimination diet. The version I did was no sugar, no caffeine, no alcohol, no gluten, and no dairy. And I was told, okay, we're going to try this for, 3 to 4 weeks, see what's happened, and then go from there. Ultimately, I get to that month mark, and I had the first night's sleep of absolutely no back pain. And I was like, literally, like, after 8 years, like the first time I was able to sleep through the entire night, not waking up because of pain and not waking up in pain in the morning. And I was just absolutely baffled. And so I went for another 2 weeks, same thing with that elimination diet, and then came the reintroductions. And the first thing that I wanted to reintroduce was gluten because I missed bread so much. And that's what I started with. Reintroduced gluten based off the recommendation from my provider. And immediately, like, searing low back pain. Not like, okay, I ate the bread and the back pain came, but like that night, and at that point I had been sleeping 2 weeks without any pain. And immediately that night, 10 out of 10, unbelievable low back pain, miserable crying, anything, like the worst that you could imagine. And I was like, wow, okay, there is something else going on here. This is crazy. Like, never in a million years would I have imagined that gluten, something I had been eating my entire life, could be linked to the pain that I was experiencing. And so the second little piece of that whole idea of trying something new was pursuing the visceral work, to look at, okay, what's going on in my organ systems? Is there something related to the organs that's impacting my low back? And ultimately, the answer is yes. Because gluten can be highly inflammatory for the digestive tract, what was ultimately found is I had a restriction within my small intestine, which basically is anchored right in front of the lumbar spine. There was a restriction within the small intestine and inflammation around my small intestine, essentially, that was referring pain or creating that presentation of pain while I was sleeping. And so the combination of those two things, the change in my diet plus the seeking of the visceral work and working to then improve the mobility of my small intestine, which ultimately had been super fibrotic due to years of eating gluten when I had an intolerance to it. So that level of inflammation over time just created such a significant stiffness and change in the soft tissue quality around my organs. And so the visceral manipulation work of really being specific to that tissue and mobilizing to improve the proprioceptive qualities and the neurological intervention and the blood flow to that area helped to restore the quality of that tissue and the mobility of the organ as a whole, which further gave me resolution and relief from my symptoms. So I was blown away, absolutely blown away, because again, coming out of PT school, I was like, never in a million years would I have thought about that link. So that really opened my mind to the power of some of these kind of alternative treatments at times, or some of the little bit more obscure interventions for what's going on, and really just opened my mind to, because at the time I was still working at this high volume orthopedic clinic, and it made me ask the questions of, what am I missing with my patients? Like, if this could happen to me, it's guaranteed that it's happening to other people. And so I wanted to know, how can I be the person that is able to make that link and treat all of it in order to reach full resolution, or help that patient reach full resolution of their symptoms. Because I felt that if I can reach that amount of, or achieve that amount of freedom, then so can someone else. And I want to be someone that can spur that on. So really, really profound. I'm beyond thankful for the work. And as I said earlier, I, like, day in and day out, am just blown away by how this plays a role in the lives of my patients. It is absolutely phenomenal. Even when I don't expect it, even when I'm like, I'm not really sure, and this is, doesn't mean that I'm a bad provider, because this happens to everybody. But there are times when you're like, do I know what I'm doing? Like, this is what I'm finding, and I think that I want to go here and work this, and I think that this might, but you can never, like, 100% know, like, every body is so complex and has such unique history. Like, I don't know all the answers. So, and I'm not going to pretend like I do. But, you have moments as a provider of like, oh, is this like the right move? Like, I hope that this is the thing that helps. And then, you just you have to trust, what your hands are telling you, what the examination results are telling you, and just kind of go with it. And then to hear how people respond to the work is just unreal sometimes. Again, even in the most unexpected cases. So that is really one of the reasons why I do want to periodically have patients on this podcast, because having conversations and talking to individuals that have experienced the work provides such a beautiful insight to how it really impacts the lives of people. And, I can talk all day as a provider about what I see, and, give you all the science background to what it is, but, and I will do that, don't get me wrong, but to hear that first person point of view of what it feels like, how things change, what you notice, like that, I think is just really, really profound. So I'm excited for that in the future. Okay. A lot of great things to look forward to. I think with that being said, I don't want to keep rambling on and on and on, but that's an idea of kind of where I've come from, why I'm here, and where I want to go with this. Again, I'm so excited about just the opportunity to educate and to, ideally bring some level of empowerment to anybody that listens. So thank you all for being here and for listening. It means the world to me. I'm so excited to see where this goes. And I'm going to be working on a new podcast name, something that's creative and fun, ideally here soon. But for now, that's it. Okay, so again, my name is Arianna. This is such a blessing to be able to do this and to speak. I love it. I'm passionate about it, and I'm excited to see where this goes. So thanks for tuning in, and I will see you next time.